In Northwest Arkansas and in the world today, the looming threat of the coronavirus hovers over us in our everyday lives. However, for a majority of us, there's a sense of relief knowing that we have availability to certain health resources. However, this is not the case for the Marshallese community. It's crazy to me to think that in a couple cities away, there's a whole population of people who don't have access to the same resources I have available to myself. In today's speech, I will be speaking of the lack of health resources within the Marshallese community, why their own health is more at a risk than other populations, why their legal status doesn't qualify them for certain resources, and the current situation with the coronavirus. Now, to understand the problem, I think it's first important to understand the community itself. Now, according to the Democrat Gazette, in 1986, the United States signed the Compact of a Free Association, COFA, with the Marshall Islands. In return for unrestricted travel within the United States for the Marshallese population, they did nuclear bomb testing on the Marshall Islands. Today, nearly 8,000 to 12,000 now live in Northwest Arkansas, with Tyson's bringing in the majority of them to Springdale. Now, according to Stat News, these COFA citizens aren't legally considered citizens. Because they are considered non-legal citizens, they don't have access to many of the safety net programs, such as Medicaid, that legal citizens do. While COFA did originally allow for Medicaid to be given to these COFA citizens, because of welfare changes in 1996, COFA citizens and non-legal citizens of the United States were now denied access to Medicaid. However, COFA citizens do pay federal taxes, yet they are being denied this access to these certain safety net programs. Now, according to U.S. News, many of these Marshallese people have insurance through work. However, many times this insurance through work either leaves them underinsured and out-of-pocket charges that they can't afford. A lot of them also don't hold formal jobs, so because a lot of them live with extended families, their job is to take care of the household or to take care of children, and so these informal jobs don't grant them insurance. Now, this lack of health coverage resources is even more worrisome when we look at their health history. Many residents blame the health diseases they have on the American nuclear testing that occurred on the Marshall Islands between the years of 1946 and 1956. These testings can be equivalent to around 7,200 Hiroshima bombs, with the largest test in 1954, which was the most powerful U.S. nuclear test in history, and it ended up vaporizing several islands and left radiation throughout miles of the islands. Some of the diseases that can be linked to nuclear testing includes diabetes. So around 46.2% of the Marshallese population has type 2 diabetes, with 21.4% of them having prediabetes. This nuclear testing also links to higher infectious diseases within the population, such as tuberculosis and hepatitis B. Not only did the testing result in diseases, however, it also shrank their food sources. The testing decimated their food sources, which ended up having them to rely heavily on canned imported food and instant food, which eventually turned into habits that they brought over to the U.S. Despite having, an abundance of natural food resources here, they still carried over these habits of eating canned and instant food. Now, because of this lack of health coverage and with the coronavirus, it's now even more important for them to have availability to these resources. And so now if we look at the coronavirus, according to the KNWA 24 News, in Washington County, around 93% of the coronavirus cases are in Springdale. And as of Friday, the State Department of Health announced that around 6% of these cases were Pacific Islanders, which includes the Marshallese community. And there have been around 15 deaths of Marshallese people. So one of the reasons for the disproportionate amount of coronavirus cases in Marshallese communities to the total number of coronaviruses is because a majority of these Marshallese people work in the Tyson's business. Around 30% of all Tyson's workers are actually Marshallese. And so of the 18 poultry businesses in Arkansas, there have been 530 cases of the coronavirus. And just in Tyson's alone, it's in triple digits at 186, which is nearly 3 times as much as the second highest number in a poultry business, which is only at 63. One of the reasons why this disease is spreading so fast within this community is because of the lack of resources. Like the majority of the rest of the country, in the early months of March and April, there was a lack of testing, which caused for the disease to spread. But not only the lack of testing, but also the warnings weren't being able to be spread into the Marshallese community because of the lack of the language barrier. There's not a lot of people in Northwest Arkansas who can speak this language. In fact, I know through research there's actually only 2 Marshallese doctors within the whole United States, one of them being located in Northwest Arkansas. And so because of this language barrier, none of the cautions and warnings were able to get out into the community or in the Marshallese language. And so, as you can see, the Marshallese community is greatly overlooked by government and programs and resources. And so today I just wanted to bring light within our community to the lack of resources for the Marshallese community. As this pandemic continues, it's important to keep others in mind and their health, whether that be through social distancing or wearing a mask when going out. As the numbers continue to increase, it's now more important than ever for this minority group to be able to be offered the same resources that the rest of the community have access to. So, thank you.